Hello everyone. Today let's study endocrine system from Pathoma. 3 things that we need to remember about endocrine glands is that they maintain body homeostasis. They function by release of hormones that travel via blood to distant organs, and feedback mechanisms control the release of these hormones. The different pathologies most high yield of each gland is written here in this table. Let's start with anterior pituitary gland. Pituitary adenoma is a benign tumor of anterior pituitary cells. They're mainly of 2 types, functional or hormone producing and non-functional or silent. Different examples of each of these types of tumors are written here below. Non-functional tumors have a characteristic phenomenon called mass effect, meaning they compress the structures surrounding the gland depending on the velocity and direction of the growth of the tumor. For example, bitemporal hemianopsia occurs due to compression of the optic chiasm. Here in this diagram, you can see that the darkened red structure is the optic chiasm, and 1 and 4 labeled parts of the eyes will not be able to see, the lateral views. When the normal pituitary tissue is compressed, it causes something called hypopituitarism. And it is symptomatic only when more than 75% of the normal parenchyma is lost. It can also cause generalized symptoms like headache. Because these symptoms are general and not based on a single type of hormone, they are hard to detect. And only mass effect, only when it causes pressure on the surrounding structures will we be able to diagnose this condition. Therefore, the diagnosis may be delayed in these cases. Hypopituitarism needs to be studied more in detail as it is high yield. Different causes are tumors like pituitary adenoma in adults and craniopharyngioma in children. They can be caused due to mass effect or pituitary apoplexy, meaning bleeding into an adenoma. Sheehan syndrome is also an important cause. It's defined as a pregnancy-related infarction of the pituitary gland. Here, the gland doubles in size during pregnancy, but blood supply does not increase that significantly. But blood loss during parturition precipitates this infarction. And this disease may present as poor lactation, loss of pubic hair, and fatigue. Loss of pubic hair occurs because there is loss of Sheehan syndrome presents as poor lactation, loss of pubic hair, and fatigue. Loss of pubic hair occurs because there is insufficient production of hormones by the anterior pituitary gland, causing decrease in the LH secretion, leading to decreased androgens, which controls the growth of pubic hair. Another important cause of hypopituitarism is empty sella syndrome. This is a congenital defect of the sella turcica. Sella turcica is present below the pia, dura, and arachnoid layers of the covering the pituitary gland. And when the arachnoid layer herniates into the sella, the normal pituitary gland gets compressed, leading to destruction. This can also be secondary to trauma. An important fact to remember about this syndrome is that on imaging, the pituitary gland is absent, meaning it looks like an empty sella. Let's talk about functional tumors. Prolactinoma is the most common type of pituitary adenoma. They present as galactorrhea and amenorrhea in females or as decreased libido and headache in males. Galactoria won't be seen in men because they have only terminal duct and no lobular units. Treatment is dopamine agonists like bromocriptine or cabergoline, which suppress the production of prolactin and therefore shrink the tumor size. You can also do surgery for larger lesions. In growth hormone cell adenoma, there are mainly 3 types of clinical presentations. In children, you can see gigantism, where epiphyses are not fused in these children, leading to increased linear bone growth. Normally, when epiphyses get fused, the growth is suppressed and slowly decreased, and they reach an indefinite growth size. But here, when they're not fused, gigantism is seen. In adults, you can see acromegaly, and there are few characteristic clinical manifestations that can help you diagnose acromegaly, like enlarged bones of hands, feet, and jaw, growth of visceral organs like heart, leading to its dysfunction or even failure, and even enlarged tongue. Usually, in these cases, patients will also present with secondary diabetes mellitus because growth hormone induces gluconeogenesis. So you can diagnose the tumor by elevated levels of growth hormone and IGF-1. Along with the elevated levels, when you take glucose orally, growth hormone is not suppressed in these cases. Normally, it gets suppressed when you take oral glucose. You can treat this tumor by octreotide, which is a somatostatin analog that suppresses the release of growth hormone. It is usually the drug of choice. You can also use growth hormone receptor antagonists or even perform surgery in more complicated cases. ACTH cell adenomas secrete increased levels of ACTH, which eventually lead to Cushing syndrome. We shall discuss Cushing syndrome in another video. Other rare types of functional tumors are TSH cell, LH producing, and FSH producing adenomas.